Welcome to the workshop, Herbs and Supplements. Are they safe for transplant recipients? My name is Marla, and I will be your moderator for this workshop. It's my pleasure to introduce today's speaker, Dr. Colleen Timlin. Dr. Timlin is a clinical pharmacy specialist in the malignant hematology and hematopoietic cell transplant cellular therapy department of the Hospital of the University of Pennsylvania. She has published and spoken extensively about management of side effects of transplant and CAR T-cell therapy. Dr. Timlin is an active member of the American Society of Transplantation and Cellular Therapy Pharmacy Specialists Interest Group, the Hematology and Oncology Pharmacy Association, and the American Society of Health System Pharmacists. Please join me in welcoming Dr. Timlin.
Thank you so much for the kind introduction. I'm very excited today to be talking to this group about herbs and supplements. Are they safe for transplant recipients? The learning objectives of this presentation, I'm hoping by the end of this workshop that attendees will understand how herbs and supplements can vary in potency and contamination, how herbs and supplements may interact with medications prescribed by a doctor, how popular herbs and supplements that should be avoided by transplant survivors and why, and how to find reliable information about the safety and effectiveness of particular herbs and supplements. I want to disclose that I have no financial disclosures, but did want to mention that this presentation will not provide individualized recommendations. I may mention this number a little bit later in the presentation, but in doing some of the research into the herbs and supplements to talk to today, a number that I came across was something about 80,000 different herbs and supplements on the market. And so there's a lot to potentially cover. We just have a short time to talk about it today. So I'm just highlighting a few of them. One of the things mentioned is that I am a pharmacist at a transplant center and very involved with other pharmacists. And the great thing about being a transplant pharmacist and kind of getting a bone marrow transplant is that we are part of the team. And so I would definitely recommend that if anyone has individualized questions that they'd like to ask, the great thing is that all transplant centers have a pharmacist. And so you may not have met them before. They are a resource that's available if you reach out to your providers that they could help direct you to get very personalized information. The other thing I wanted to mention as well, too, while a very interesting topic, this presentation, as I mentioned, has a whole lot in terms of what we could potentially cover. And one of those things that I tried to focus on today and exclude would be marijuana and CBD or THC, because that was presented by another pharmacist earlier in the week. So there's a whole session on it that I think is really helpful to give us time to talk about some of the other ones that I wanted to highlight that aren't presented in another session. So I think an important question is, what exactly is a supplement? So Congress defined the term dietary supplements in the Dietary Supplement and Health Education Act, or DSHEA, of 1994. And I'll mention this a few times because it's really important in terms of what defines the regulations and how we define supplements going forward. So a dietary supplement, it's a product intended for ingestion that, among other requirements, contains a dietary ingredient intended to supplement the diet. So in other words, dietary supplements are products that are ingested and intended to add or supplement the diet. Federal law defines a dietary supplement as products that you take by mouth, so it could be a tablet, a capsule, a powder, or a liquid. Again, it's made to supplement the diet. It has one or more dietary ingredients, which may include vitamins, minerals, herbs or other botanicals, amino acids, enzymes, tissues from organs or glands, or extracts of any of these. And they also must be labeled as being a dietary supplement. On the other hand, herbal supplements, sometimes called botanicals, they are a type of dietary supplement that contains one or more herbs. Dietary supplements may be found in many forms, such as pills, capsules, tablets, gummies, soft gels, and powders. They can also be in the same form as a conventional food category, such as teas or in bars, but only if the product is not represented in a conventional food or as the sole item in the meal or the diet. Plants have been used for medicinal purposes long before recorded history. Ancient Chinese and Egyptian papyrus writings describe medicinal use for plants as early as 3000 BC. Indigenous cultures used herbs in their healing rituals, while others developed traditional medical systems in which herbal therapies were used. In the early 19th century, when chemical analysis first became available, scientists began to extract and modify the active ingredients from plants, and later chemists began making their own version of plant compounds, and over time the use of herbal medicines declined in favor of drugs. Interestingly, I wanted to point out that almost 1/4 of pharmaceutical drugs are actually derived from botanicals. So a lot of, as we're kind of getting more popularity into being more natural and being more organic, I think that's really interesting that 1/4 of the pharmaceutical drugs are derived from the botanicals. And recently, the World Health Organization estimated that 80% of people worldwide rely on herbal medication for some part of their primary health care. One of the countries that uses herbals very much in their care is Germany. And in Germany, they have about 600 to 700 plant-based medicines that are available and prescribed by about 70% of German physicians. So very heavily used in German society. In the past 20 years in the U.S., public dissatisfaction with the cost of prescription medications, combined with an interest in returning to, again, natural or organic remedies, has led to a significant increase in the herbal medicine use. There is an estimated 80,000, again, products that are currently on the market. And I would say in my practice, I probably get at least one question a day from patients discussing herbals, their use, checking to see if it's something that would be safe for them to take with their other current medications. So why do people take supplements? So your doctor may prescribe a supplement if you have or may develop a vitamin deficiency caused by treatment. For example, certain cancer therapies weaken bones and can contribute to the development of osteopenia or osteoporosis. So in these cases, your doctor may prescribe calcium and vitamin D to support your bone health. In some cases, supplements may also be needed if your cancer treatment makes it difficult for you to get the nutrients that you need from foods, such as fruits, vegetables, whole grains, and meats. Alternatively, some patients who've had surgery or have part of their digestive tract removed, maybe in the stomach or the intestines, these patients might not be able to absorb certain vitamins or minerals, so they may need to take a supplement to get those nutrients in their diet. One big misconception is that we all need supplements. Really, unless you have a known history of a specific vitamin deficiency or at risk for one because of your treatment or the cancer itself, it truly is best to get your nutrients through food. Another misconception is when you take something, say like a multivitamin, is that your body will use what it needs and get rid of the rest. So in truth, it's better not to introduce supplements into our bodies that we don't need, or to overload your body to filter all those things out if they don't need it. Even though dietary supplements can be beneficial, they should not take the place of the variety of foods that are important for a healthy diet. So I definitely encourage really for people who have the diagnosis of cancer and really want to feel better is that the food source is the best source for nutrients. The FDA, or the Food and Drug Administration, considers vitamins, herbs, and botanicals as food, not drugs. And I think that this is really important to differentiate the two. Many people incorrectly assume that dietary supplements are tested by the FDA for safety and effectiveness. But unlike drugs, the FDA does not have the authority to approve dietary supplements or their labeling before they are sold to the public. So it's a different process in terms of how they're regulated, and also to the process in which they can come to the market. So while manufacturers must ensure the products are safe and that all the labeling claims that are on a supplement are confirmed through evidence, dietary supplements do not require the FDA approval before they are marketed. So again, drugs have to go through a rigorous process where it's not necessarily that same process for herbals and supplements. The FDA can only act against misbranded, unsafe, or adulterated supplements after they are on the market. So for drugs that primarily are very heavily integrated, the FDA is before a drug gets to market, whereas with herbals and supplements, they're only integrated after it comes to market. If a product is found to be unsafe or not otherwise in compliance with the law, the FDA can work with the company to bring the product into compliance, or they can possibly recommend it be removed from the market. So again, under the 1994 DSHE Act, manufacturers are not required to provide information to the FDA prior to marketing. This DSHEA limited the FDA pre-market review and approval of dietary supplements and also removed the FDA's authority to test dietary supplements. So as a result, that rigorous necessary control that the FDA legally had over prescription products was kind of invalidated or taken away from products. And so, again, I want to really emphasize that it's a different process, the way that both drugs come to market and then the herbals and supplements come to market as well, too. Despite these limitations, though, the regulations that are in place for herbals and supplements do spell out that companies are responsible for ensuring that the dietary supplements they sell are safe and properly labeled. According to the Tufts Center for the Study in Drug Development, the full research, development, and approval process for a new drug product can take anywhere between 12 and 15 years. The investment made by drug manufacturers to get a new drug from the initial research to patients oftentimes exceeds $2 billion. Only 1 in 1,000 of the compounds that enter the lab testing ever make it to human testing, and only a small percentage of those even make it to market. The FDA must regulate and approve new prescription drugs before they can be sold to the public. The manufacturer follows a series of important steps through animal studies and clinical trials in humans to ensure a medication is safe, does what it claims to do, and provides a health benefit. Generally, the first step in creating a new medication begins with finding a gene or protein, something, a target for the medication that plays a role in a specific disease or medical condition. And this gene then becomes the therapeutic target for the medication. And once this new potential medication is identified, it's tested in a laboratory, and this is done long before it's even ever used in humans. And testing is performed first in laboratories and on animals to determine if a drug is safe, and it can be used before we use it in humans to understand how it works in people. If the laboratory supports the safety of the medication, then it can go on through the clinical trial phase. An application to the FDA is made to start in humans. And just to think about at each step of the process here that's listed, between the basic science research to FDA approval, that start number of about 15,000 or 1,500 that I mentioned before significantly drops down to a very, very small percentage that actually then goes from FDA approval. So I really wanted to highlight how rigorous this process is, how time-consuming it is, and how despite such a huge number at that very first step of potential targets or things that may be beneficial for treating a disease, that only a very, very small percentage of those actually go and eventually are able to be used in patients as treatment. And so again, the drug process is very, very different. And as I keep saying, it's very rigorous. in terms of the time that's invested, the number of people that are involved and tested on, and also too the investment in financially as well for the companies to have them go to market. Once a medication is approved, another kind of crucial step is that drug companies or manufacturers are required to continue to monitor the safety of the drug as it's on the market. And so this ensures that any serious or rare side effects that may occur in the clinical or that may have been missed in the clinical trials are still caught, they're still evaluated, so that in case there is a safety issue, that medications can be taken off of the market. And again, I really wanted to spend time again to really hone in on the process, the science involved, and really kind of the trust in the science of the process. So in terms of herbals and supplements, is what I consider to be scary is the FDA found some deceptive practices that may have occurred with herbals and supplements because they don't necessarily go through the same testing. So the FDA has found what is listed on the label of a dietary supplement may not be what's actually in the product. So the product may cause injury, death, or other serious effects even when it's used as directed. For example, some products marketed for weight loss, sexual enhancement, or bodybuilding have been found to contain prescription drugs that are not allowed to be in dietary supplements. Or equally as scary, products that contained other ingredients that are not listed on the label, and some of these ingredients may be safe. So despite an herbal or supplement claiming to be what is on the label, sometimes it's not actually. Sometimes there are more things on it than what is listed, and sometimes the doses that are listed are not exactly what is included. And I'll give an example later in the presentation of one that's been in the news recently. I think it's also important when looking at an herbal or supplement and trying to determine what is in the product to be cautious of terms like proprietary blend. So if a manufacturer isn't willing to share all of the ingredients on the label, you're not really going to know what's in that product. A study once used DNA barcoding of over-the-counter supplements and found incorrect labeling on almost half of those included in the study. As an example, in that study, one product was labeled as having St. John's wort, which is an herbal product we'll talk about later that's commonly used to treat depression, but the product actually contains senna, which is a non-prescription herbal laxative, so something absolutely completely different than what was on the label. So it's important to know what you're putting into your body so you don't accidentally take something that could have an unexpected or negative impact on your health. So for those circumstances where it is indicated that you do have a deficiency and need to take a supplement, I think it's important then with some of those deceptive practices, so how do you find a reliable source or a reliable manufacturer if you do need to take something over the counter? And so the U.S. Pharmacopoeia sets the most widely accepted standards for dietary supplements. And there's actually a list of USP verified products that you can find online, and that is quality-supplements.org. You may also find seals from other valid third-party testers or other kind of seals of approval that include NSF International, UL Solutions, and Consumer Labs. And I put pictures of those up here on the slide so you can easily identify them when you do go into a pharmacy and are looking for a quality product. Some products will create seals to make them look like they're more reputable, but beyond those ones that are listed here, ignore unknown certifications even if they look official. Dietary supplement labels also, to ensure that they are a quality, they must include a company contact that has a U.S. address or a domestic phone number for reporting any serious adverse events to the manufacturer, packer, or distributor, so that they can be reached and those complaints may be made. So that's another kind of way to determine if a manufacturer or a product is a higher quality product. And one of the things that I think is important in looking at a product and helping select as well too is to choose the one that has the most minimal ingredients. And so the least amount of ingredients in a product, the better, in my view. So if you need to take a supplement to address a vitamin deficiency, ideally you want it to contain that ingredient with as little possible beyond that. So if you don't need anything extra, you don't need to take anything extra because of, the chance that it may be something you don't want or don't need to take. So try to minimize as much as possible. So in thinking about kind of the risks in taking supplements is that most supplements are considered to be in much higher concentrations than ingredients that are found in foods. Even supplements that do have research behind that ingredient, supplements that you buy from stores or online may offer or may differ in important ways from products tested in research studies. And so what this kind of statement means is that, there are research that is done on some ingredients. And so what's important in those studies is looking at what the doses are, what the diseases are that are taken, because again, even though the study may show the results in that ingredient, it's important to have the right manufacturer, the quality manufacturer, again, to reiterate the fact that you want to make sure that you just have that supplement and only that supplement in the product and at the correct dose that they're claiming to be on the label. Some supplements can contain different or mega doses of the ingredient. It may not be clear on some labels or some bottles how much or how often a supplement should be taken. Oftentimes when people are taking supplements, they're taking more than one supplement at a time. So again, sometimes supplements can interact with each other. And so that's another really important thing is that you want to be cautious not to be kind of starting or taking too many supplements at once. And so to ideally try to focus, if you are going to start something, and just do kind of one at a time. So some people have distrust in the pharmaceutical industry or the medical profession and opt to use supplements instead of recommended medically proven treatment. So obviously there's a risk outside of taking just that supplement, but patients may also now have the risk of their disease becoming worse during that time if it's not being treated. And potentially the disease may become more difficult to treat if they later realize that those supplements have now failed and they have to use a medical treatment. So again, they lost that time in kind of treating the disease when it was maybe a little bit less aggressive or maybe less severe. They delayed it in taking supplements. So that's one of the risks in kind of taking something that isn't proven to be effective in a disease state. Adverse events can range from less serious to life-threatening, and taking supplements if they could be harmful. Some side effects oftentimes can be rash, fatigue, persistent severe vomiting or diarrhea, difficulty urinating, joint and muscle pain, chest pain, or stroke. So again, I think it's important that even though supplements are easily accessible and they're over-the-counter, doesn't necessarily mean that they're safe. So everything should be verified with your pharmacist, with your doctor, to make sure that they are a good quality product, that they're okay to take with the medications that you're taking, and that you have somebody review each one before you take it. An important part of breaking down both medications and supplements, kind of your powerhouse, is your liver. So your liver is really the body filtration system, again, in focusing on medications. There are certain parts of your liver called enzymes which break down both medications and herbals. So when we think about kind of the liver and the breakdown of medications is that we have in our clinical trials and looking at it kind of what the typical breakdown is. And sometimes when you take herbals and supplements, they're broken down very similarly to the way that medications are. And so sometimes the way then that your body breaks them both down is that herbals kind of compete with the medications and getting broken down. So if they're both being broken down at the same time, it slows the way that the drug gets broken down, so it stays in your system longer and could potentially cause more side effects because it's staying in your body longer than we had anticipated or that it should be. And again, your liver function in breaking down medications, it's an important part of your blood system. So as the medications are broken down, again, kind of getting them to where they need to go. And your liver is also important as part of your dietary and medication breakdown as well. So again, it's very important and something that, again, in taking both herbals and medications and breaking down food can sometimes kind of cause medications to be in the system or even herbals in the system longer than intended. So to use kind of caution. All of us, I believe, are very familiar with the nutrition labels that are found on food, but are you aware that herbals and supplements have labels as well? So to be a dietary supplement, a product must be labeled as a dietary supplement. So therefore, the product label must include the actual word dietary supplement or equivalent, or it can say, iron supplement, it can say herbal supplement, and that DSHEA we talked about earlier, it places dietary supplements in a special category under the general umbrella of food unless the product meets the definition of a drug. So again, because a drug actually can say it's labeled to treat or prevent a disease. So similar to the food label that all of us kind of recognize, there's requirements that have been placed on dietary supplements to include on their label. So regulations place dietary supplements, again, in a special category under the umbrella of food, unless it kind of beats that definition of a drug. To be a dietary supplement, a product must be labeled as a dietary supplement, and dietary supplements are required to have a supplemental facts label similar to the one that's shown here on the slide. The supplemental facts panel must list the serving size and number of servings per container. It must declare each dietary ingredient in the product, the dose of each ingredient, and except for dietary ingredients that are part of that proprietary blend we talked about earlier, it must provide information on the amount of the dietary ingredient per serving as well too. Depending on the type of ingredient, the amount per serving must be declared as either amount by weight, as a percentage of the daily value, or both, as seen here on this label. Any additional ingredients or any other inactive ingredients must also be listed as part of the dietary supplemental facts label. So again, I warn you to be cautious of products that have proprietary blends in their supplement facts because we don't know what components may be in that blend. And if a manufacturer isn't willing to share all the ingredients on a label, it's difficult for people in the medical field, like physicians or myself, to understand what's really in a product, to be able to check it, to see if it is something that's safe to take with your medications or something that's safe to take maybe with any of the medical diagnoses that you have. So one of the other really important parts of a label is that for a supplement, it's required that the label bear the disclaimer that this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. And so again, they cannot make a claim for supplements or herbs that they prevent a disease, that they diagnose a disease, that they treat a disease, because there's no basis for saying that. So again, the only way that you can say those types of things, that it can prevent a disease, that it can prevent or treat a disease, is if there are research studies and clinical trials in which those things are shown to be true. So some of the supplements that I'm going to focus on today to discuss are listed here on this list. As I alluded to earlier, the number of supplements on the market is astronomical, and so even narrowing it down to these few certainly I know is difficult since there are so many out there. I'm focusing even within this group as well to some more than others based on some of the questions that I get from people, and also too to try to focus on maybe ones that do have more information about them than others. So one that I think I get questions on very often is vitamin D. So I'm going to go a little bit into detail more so with this and maybe some of the others to talk about kind of what it is in a little bit more depth. So vitamin D promotes calcium absorption in the body, and having enough is central to health and well-being, offering the promise of protecting bones and preventing bone disease such as osteoporosis. Supplemental vitamin D is popular because it's difficult, if not impossible, for some to get enough from food. So the Centers for Disease Control and Prevention, or the CDC, notes that our bodies also make vitamin D when bare skin is exposed to the direct sunlight, but increased time indoors and widespread use of sunblock has been really promoted recently to prevent skin aging and skin cancer. And so staying indoors more, using more sunscreen has minimized the amount of vitamin D that many of us get from sun exposure. So vitamin D is something that we can measure and check and see kind of what the levels are in the body. Vitamin D supplements are a little bit of a tricky topic, and sometimes it seems that guidelines and research can often at times contradict each other. So for example, when healthy pre- and postmenopausal women take vitamin D, and the doses are really small, just at 400 international units, in the clinical trials, it hasn't been shown to necessarily prevent them from breaking bones. But high doses, so thinking, well, if a little doesn't work, should I take higher? But higher doses aren't necessarily a better option either. So for those taking too high or having high vitamin D blood levels, it can actually cause an increase in calcium absorption. So people can get more side effects from taking too much vitamin D, such as those listed here: muscle pain, mood disorders, abdominal pain, kidney stones. It also even could potentially raise the risk of heart attack and stroke. So more is not necessarily better when it comes to supplements. That being said, though, vitamin D supplements, again, too, it's something we can measure. It's something that we can see that there's a deficit. So vitamin D supplements may benefit certain people. So those at risk or have a deficiency, those individuals with darker skin, certain health conditions, and older patients. The most recent American Geriatric Society statement specifies, it suggests that people older than 65 can help reduce the risk of fractures and falls by supplementing their diet with vitamin D, in addition to calcium-rich foods. Anyone can bolster their vitamin D also, too, in the sun if they don't have sunblock. And so highlighting kind of some of the possible side effects here, and again, too, in the risks maybe to avoid for patients with kidney stones, kidney disease, or high blood calcium levels as well. I'm going to go through these next ones a little bit faster to be respectful of our time. So this is the next one is the one that I had alluded to earlier that's been in the news a lot lately. There was recently a warning last month from pediatricians in relation to melatonin gummies. So JAMA, which is a medical journal, researchers found that some of these gummies contain higher doses of melatonin than are listed on the label. Some products even contain less than advertised or high doses of other ingredients such as CBD. So of the 25 melatonin gummies analyzed, about 90% were inaccurately labeled, and only 3 or 12% contained the amount of melatonin that it said was on the label. So again, reiterating for this, and like I said, I wanted to bring it up since it was something in the news recently, that despite kind of melatonin having being a hormone, that the body produces and plays a role in sleep, it's released by the brain in response to darkness. It's commonly used as an over-the-counter sleep aid. It's a little bit, I think, used different than what people think, is that it helps your body set your sleep time or when you should fall asleep versus it being something that actually makes you fall asleep. So it's not, a sleep aid. It's not something that knocks you out. So it's not something that you wake up in the middle of the night and take to go back to sleep. Sometimes, especially too with the warning with the gummies, is that oftentimes manufacturers, because gummies degrade faster, have higher numbers in them. And so again, to be cautious of gummy products, that was something that was taken out of that statement that was released last month. The other thing that's important about melatonin too is that sometimes you can see a hangover effect or grogginess in the morning, so it can have an opposite effect of what you want in being rested and alert for the day. If melatonin is something, the doses are typically on the lower end, so 3 to 5 milligrams versus some supplements on the market maybe up to 20 milligrams. So I'm going through the next few a little bit quicker. Is milk thistle. So milk thistle is reported to be used in liver damage in patients with Alzheimer's disease. Some food sources where you could derive milk thistle as opposed to supplements are in the seed, pot, or fruit of the milk thistle. This medication does have a lot of drug interactions because of that, like we talked about earlier, the way it's broken down in the liver. Some of the side effects actually may be an increase in those liver tests or an upset stomach. And again, very important if you're considering starting this to ask your doctor or ask your pharmacist, because milk thistle does have a lot of drug interactions. Saw palmetto is used for patients for prostate cancer, urination, BPH, anti-inflammatory reportedly. Some food sources that you may find naturally saw palmetto are in the fruit of a dwarf palm that grows in the coastal lands of North America, the West Indies, and Mediterranean countries. Some of the drug interactions the supplement may have are with blood thinners and anti-inflammatory drugs such as NSAIDs. Some of the side effects that you may experience if you're on saw palmetto include upset stomach, tiredness, headache, a decreased libido, a runny nose, or bleeding time. And again, be very cautious with this and make sure you would discuss with your pharmacist or your physician, because it does have many drug interactions, especially really important ones like those blood thinners. Another one I get a question on a lot is biotin. So biotin is an essential vitamin that helps with the production of keratin, which is a protein that's used in the formation of nails, skin, and hair. So it's important with biotin that the studies have focused or have been shown its benefit in hair loss. And so I think it's important to know there's a difference between something that helps promote hair growth and something that helps prevent hair loss. And so for right now, there isn't enough research that states that it can help grow. But again, it's been found to be beneficial in patients with hair to prevent hair loss. So if you want to incorporate biotin into your diet, it's present in many foods, including beef, liver, eggs, salmon, pork chops, sweet potatoes, almonds, those listed here. Some of the possible interactions to note, which are important, are certain lab tests. So again, to ensure that this is a medication that you mention whenever you talk about your drugs that you're on, so that it can be run to make sure that it doesn't interfere with any of the lab tests for those drugs. And again, to take home that it may cause that interference, to let your providers know. If you're going through any diagnostic procedures, or to make sure that there's not an incorrect response to therapy. Turmeric is another one important to talk about. Reported use in cancer, infections, inflammation, and joint pain. Some of the food sources that you can find it in, sometimes cooking and curries, include turmeric. This has, as you can see, a huge list of possible interactions, which is important to say that, again, it's generally preferable to use turmeric in your food and tea because it's in much lower doses and tends to not have the possible drug interactions to the same level that the supplements do. Glucosamine, I'll go over this one again really quickly. I'll let the group read this one to focus on some of the other ones I have listed here before the end of our presentation. Garlic is another, again, that is reported here for the use in cancer, heart disease, infections, that I recommend kind of through food sources such as the bulb or clove of the garlic plant, noting that if you do take a garlic supplement, that it should be stopped 1 to 2 weeks before surgery because it may increase your potential to have a bleeding complication after the surgery. Another popular one are probiotics, so reportedly for digestion or bowel function. Probiotics can be found in yogurt, miso, tempeh, pickled vegetable here. It does have a lot of interactions potentially when you're on therapy for GVH because of the fact that it affects your gut flora. And so oftentimes people have GVHD in the gut. So it's something that we try to avoid for people who have GVHD. Also, it can potentially cause infection. So again, we recommend that patients that are on immunosuppression avoid it. If you're neutropenic, avoid it, or if you're on treatment for GVHD. Some information here on fish oil that I'll include. Let's get St. John's wort. The one message I wanted to give about this was that it has been kind of looked at for patients with depression, anxiety, fatigue, sleep, menopause, and to heal wounds. And kind of the one flag that I certainly think of with this medication, again, too, is that this has a lot of drug interactions, as you can see listed here, and really important ones. So your blood thinners, your cholesterol medications, so to use with caution and certainly make sure that you discuss with your providers because it can decrease the efficacy of some chemotherapy. So to stop it at least 1 week before surgery or chemotherapy. I'll go through this one quickly and kind of I can answer any questions if they come up about it because this is another one I often get questions about. And is apple-aquion. So this is the main ingredient in the dietary supplement Prevagen. So just to be cautious that, again, too, that with this product, the supplement or the supplement maker had been charged with false advertising. So again, to be cautious with supplements and them making claims on efficacy. I wanted to be sure to include this list of herbals to avoid for patients after transplant because of the risk of drug interactions that are with a lot of the medications after transplant. So again, before you would consider any of these at all, that you should absolutely talk to your provider to make sure because of the risk of side effects. So specifically, concerns for our stem cell transplant patients when it comes to herbals and supplements. Number one is the interference that they may interact with chemotherapy. So they may, and when I say chemotherapy, it may be the chemotherapy that you're getting prior to your transplant. It may be kind of some of the things used for maintenance after, or maybe even the immunosuppression. So it can make it less effective. It could potentially make the side effects more toxic. And so again, to try to avoid the use while you're on treatment. But if you do have interest, again, reach out to your pharmacist, reach out to the pharmacist at your transplant center or your physician, and they can kind of help guide you. The drug interactions, the supplement reactions, another really big as well too, like we talked about, is that graft versus host disease often occurs in the liver. And so this is also where a lot of the herbals and supplements are broken down. And so sometimes herbals and supplements can be confusing and cause rises in those liver numbers that may make us think that graft versus host disease in the liver is there when it's not, or may be worse than what we truly think it is. So a word of caution is to try to avoid using supplements if you do have graft versus host disease. And again, because of those changes in the liver and organ function. I also think it's very important for our transplant patients, if you are considering using supplements, that timing is really important. So definitely we recommend to avoid in the first 100 days of transplant, since your body's undergoing so many changes, to try to avoid it while you're on immunosuppression, because we don't want to decrease the efficacy and cause any rejection because of the drug interactions. Like we talked about on the last slide, to avoid if you have any graft versus host disease as well, because it can make it really confusing if your liver numbers bump. And again, if you are interested, to start only one new product at a time. So not to start kind of 3 different herbals, because we don't know how each of them mix with each other. Some additional resources I wanted to list here, and a big one actually that came out as I was doing this presentation is that back in March of this year, the FDA unveiled a new dietary supplement ingredient directory, which I think is a really important resource for consumers. This is a web page. It's intended to help the public stay informed about the ingredients in dietary supplements. So consumers can use the directory. They can look up ingredients used in the products marketed as dietary supplements. You can find out what the FDA has said about the ingredient, whether the agency's taken any action against the ingredient. So it's really a way to inform the public, a way to be able to look up what's in the supplement and see if there's been any FDA warnings against kind of that supplement. So again, that's the FDA had unveiled it, and they have a lot of really, really great web resources on their website that I'd encourage people to go and look at if you have any questions or interest. And so now I'll turn over, I'll say thank you for joining in today and address some of the questions that we have here.
Okay. Thank you, Dr. Timlin, for this excellent presentation. We will now begin the Q&A. If you have a question for Dr. Timlin, please use the chat box on the left side of the screen to submit your questions. We will answer as many questions as possible in the time remaining. Do you consider collagen a supplement? I'm considering taking it to improve skin elasticity.
Well, I think that's a really great question. So collagen can be something both found in food, or it can be something that is found as kind of a separate supplement. So there is collagen actually that's part of what's in capsules. So it's in a lot of different things. I definitely am very a strong proponent in getting it in diet. And so if you're able to get it in your diet, that would probably be the first place that I would recommend going to. In getting it. Otherwise, in thinking about supplements, there isn't a lot of, I'll say, really great data about what product to use, what doses to use. So it's a little bit of the wild, wild west. And so, again, kind of a reason why I think it does have potential, and would definitely say if you're able to incorporate it into your diet.
Thank you. Next question is, what is the maximum amount of vitamin C I should take post-CAR T? What is the maximum a person in good health should be taking?
So that's also a really, really good question. So one of the things I'll say too is that we don't really know. We don't have a good idea kind of what that maximum number is. And also, too, kind of we don't really know if there's a reason that you need to take kind of that really high maximum amount after CAR T. And so there's lots of ways, again, too, that people take vitamin C. Some people take it as those really high doses in IV form. You know, that's not something that we recommend at our program. So again, kind of if you had the interest in taking a supplement, most commonly we would recommend just kind of taking the vitamin C or taking a multivitamin to help supplement the diet, that there's no information that you really need those mega super doses that are seen in some of the supplements. And we really do get very nervous if you're thinking about doing it the IV supplements, because we don't want anybody piercing the skin or putting something into your veins that could be dangerous and being a higher risk for causing an infection. So thank you for that question.
Thank you for that answer. The next question is digestive enzyme safe to take after BMT?
So that's a really good question too. You guys are really have a lot of good ones for me today. So digestive enzymes, so there's lots of different ones that you could possibly take. And so again, I think there are some people that need that help. So things like lactase, you may become lactose intolerant after transplant. That is something very commonly seen. It's actually also more commonly seen as we age, is that we may become more and more. So I would say that those are safe supplements to take, especially, again, if it's causing gas or diarrhea, things that are difficult as well, too, and maybe confusing for GVHD symptoms. Some of the other enzymes as well, too, there's things called pancreatic enzymes. And so for people who have graft versus host disease in their pancreas or have difficulty breaking down fats, those are also dietary enzymes are recommended there. So those are all really great things that I would say may be appropriate, and definitely encourage, to reach out or, to talk to providers if that's something that you have an interest in or having kind of some of those symptoms that you'd like to address with the dietary enzymes.
Thank you. This person asks, I have read that BitK2 can be useful in directing calcium to the bones. Do you agree with this opinion?
Wow. So I do have to say that congratulations. I haven't heard of that one in my research. That specifically is BitK2. So that would be one that I would actually have to look into and learn a little bit more as well. So I would say on the safe side, if you do have an interest in taking that, again, to contact the pharmacist at your transplant center, and they might be able to give you things that are specific and can look at your medications and see as well too. So you picked one of those 80,000 that I didn't know. So thank you for teaching me something new today too.
It was Stump the Expert today.
Great job.
The next question is, you listed vitamin D interaction with Altervastin. Please explain.
Sure. So vitamin D is listed as having a drug interaction with the atorvastatin, and thinking about kind of it can, so I would say there are certain statins based on the way that your body breaks them down that are more prone to drug interactions than others. So atorvastatin is one that is known to have a little bit more drug interactions than others. And so just unfortunately, you might be able to take another statin. So other names are pravastatin, or Crestor is a brand name of another medication that are in that class but tend to have less drug interactions. And so that is a possibility if you are on atorvastatin and potentially either considering or on vitamin D. So that's another good question.
Thank you. I'm going to kind of combine these two. They want to know someone wants to know how do you know if a supplement manufacturer is legitimate? And someone had asked, vitamins and supplements that are sold at Costco and Sam's Club, are they okay to trust?
Mm-hmm. Yeah, so I think that's a really good question and something I experience as well too. And so in thinking about supplements, really, if you have the opportunity to go and look at the slides a little bit earlier that have those fields of approval, the big one that's important is the USP seal. And so those aren't always necessarily the ones that are sold at Costco. I think of one of the brands that is on that list that has it is Nature's Made vitamins. And so those would be kind of a specific brand versus like a Costco brand or versus like a CVS brand or something along those lines. And so they might be a little bit more expensive than say like the CVS or the Costco brand. But you know that that company has sent their product to the USP to get verified that it's the right supplement in there, it's the right dose that they're claiming to be on it. And so it's a way to really kind of be a seal to show the integrity or kind of the honesty of the company. I think to myself sometimes if those aren't available, big companies like Costco or big companies like CVS, they also have their reputation on the line. And so while it does take money and investment, to get that USP seal, I think it's about establishing trust with a supplement. And so if those supplements, like I said, financially there's a lot going on after transplant, that kind of the vitamins may be one area that you can cut back in. It's always my recommendation to take a quality product, but if you can't have a quality product, I would certainly take a Costco or a name brand versus something you just kind of order on the internet that you're not sure where it's coming from. So I would probably personally prefer that approach versus the online, approach.
Great, thank you. And this will have to be our last question. I'm going to combine this one as well. This person asks if a prebiotic and a probiotic are safe for 1 year after BMT, and if you can use ginseng after chemo for tiredness.
So those are really great questions. So 1 year after transplant is a really important milestone. And so I would say prebiotics and postbiotics, the caveat or kind of the thing that would change my mind is whether or not at that point you have graft versus host disease or if you're on immunosuppression. And so if you say yes to either one of those things, if you do have graft versus host disease or if you are on immunosuppression, I would still say at that point to avoid any probiotics or prebiotics because those are actually live bacteria that you can be putting into your stomach. So again, I would tend to prefer dietary supplements such as yogurt cultures and eating those versus kind of the supplements at that point. And then the second question was ginger with chemotherapy. So ginger is definitely one of those herbals that has been used in traditional Chinese medicine and has been associated definitely with nausea. And so where I've found people have the most success with ginger is actually in taking it as a lozenge. So people can sometimes drink ginger ale as well too, and that's kind of thought that it can kind of help settle the stomach. It doesn't, because ginger has been around so long, it doesn't have kind of these new clinical trials that prove it to be that way. But like I said, kind of in what I see in our patient population, is that ginger and the lozenges are helpful, or kind of ginger ale can be as well too, versus kind of like taking a pill or a capsule of the ginger.
Okay. Dr. Timlin, thank you so much for that very comprehensive presentation. On behalf of BMT InfoNet and our partners, I'd like to thank Dr. Timlin for this very helpful presentation, and thank you, the audience, for your excellent questions. Please enjoy the rest of the symposium.
Thank you.